Institut Pasteur of Dakar is one of the leading biomedical research and public health institute in Africa. And as such, since the beginning of the COVID, we have been involved in capacity building, in manufacturing, in research. We have trained at the very beginning 25 countries and make sure through those 25 countries have the capacity to do diagnostics. It has been really helpful to set foundation in all the countries to develop some network and to help testing in general under the leadership of African Union, WHO, and WAHO. The second important aspect where we've been working is really also supporting other countries in line with this capacity building. And today we're supporting 13 different countries in sequencing and making sure that the different variants circulating in Africa are also being actually characterized so we can follow up on the epidemics. And today, we are actually made available several COVID-19 antigen tests that is available and being used on a routine basis in Africa. The third thing is really when it comes to research. Institut Pasteur of Dakar has been involved in research, trying to understand how the virus evolved over time. Lastly, we are working in coordination to tackle the vaccination problem. Institut Pasteur of Dakar has this vaccine manufacturing project called Madiba. But the purpose is really to build a platform to make sure that we can deliver COVID vaccine within the pandemic and at the same time getting ready to do other vaccine for mid and long-term impact in Africa.
In the early onset of the pandemic, many different organization groups and companies work on vaccine production, but we have not yet seen one from the Institut Pasteur, which has the capacity to produce vaccines. So what has been the situation?
Institut Pasteur is one of the vaccine manufacturers, the only in Africa that is WHO pre-qualified for the work they've been doing since 1966 and way before for WHO, and making sure we have a vaccine that is WHO pre-qualified. So meaning that expertise has been leveraged by African Union, Africa CDC to be able actually to support and build capacity in Africa to make COVID vaccine available. And this came really from the inequity that happened when it comes to vaccine delivery and vaccination in general in Africa. So that project has been built with different partners and consortium. We have some development financial institutions like IFC, World Bank, KfW for Germany, AfD from France, or DFC from the US. One other thing that we've been doing is working with key stakeholders like CEPI to help actually deliver the project from the point of view on the technical perspective, from the regulatory perspective, and also bringing some expertise and helping the whole project actually to be landed. Our perspective is to be able to start making vaccine so fill and finish this year, and also make sure within the next 2-3 years, we will be able to finalize a platform where we can do end-to-end manufacturing, and not only of COVID vaccine, but also for other vaccines that are relevant for our expanded program of immunization, for children immunization.
Now, COVID vaccine development has put on the map the messenger RNA technology, while a more traditional approach has been also utilized by some vaccine manufacturers. What is the approach with the vaccine made by Institut Pasteur Dakar when it comes to COVID, and why?
When we talk about the technology, actually, Institut Pasteur Dakar has been in a position to build a platform that can do different technology, including messenger RNA. Messenger RNA as one of the technology that would may be important for the future and have a lot of advantage to build new vaccines and bring new vaccine for Africa has been one of the targets. And that's why we have this collaboration and partnership with BioNTech. But also we are pursuing some other vaccine technology, like the one we're using right now for yellow fever, which is based on eggs, but also looking for other technology like viral vector to be able to deliver the best vaccine that would exist not only for COVID, but for others.
What are the main takeaways from this pandemic for the Institut Pasteur of Dakar?
Africa has to be self-sufficient when it comes to epidemics, and particularly in the field of commodities, and make sure that we can provide a tool that would guarantee our health security in the continent. And it means that being able actually to manufacture diagnostic and to manufacture vaccine to get started, but also therapeutics. The second important aspect is really the need of coordination between African countries. Africa has to make sure all the time it can rely on its own capacities and build the capacity that exists here. And the last thing is, for the future, it's very important that we get ready and prepare now, because what we can see from the pandemic is that it may have a huge impact in terms of the development, the economy, the human capital, and making sure that we get ready in the future for that is, for me, very, very important.